All right, so let's go ahead and get started. First off, I would like to welcome you all to the CACFP Thinking Thursday Mind 2.0 session today. We so much apologize for the conflict in scheduling from a couple weeks ago, but we are so glad that you are here with us today to do this Thinking Thursday. And just hopefully this today will help answer so many of your questions that you have about the new claiming system. Okay, so let's go ahead and get started. So first off, everybody is muted. So we ask that you all put your questions in the Q&A box at the bottom of your screen. The chat will be used primarily for us to share information with you, but please put all of your Q&A in that Q&A box. I am joined with our amazing CACFP staff that will work diligently through your questions as we continue through the session today. And we will do the best we can to answer any and all questions that you have. And anything that we can't answer, we will try to follow up with you on, okay? So again, please just put all of your questions in that Q&A box and not the chat. So as we get started today, a few reminders. All of our Thinking Thursday presentations are posted on our CACFP training page, so you can refer back to them at any point in time. All of those will have the PowerPoint specific, but if you need any additional information, please reach out to your assigned analyst and we can get you the actual recordings for those. That can be found again on our CACFP training page if you scroll all the way to the bottom, and there's the link for the Thinking Thursdays. After today, the certificate will be emailed, so you must attend the entire webinar. I believe that when you registered that it may have asked you for your My Registry information as well. So we will go ahead and upload all of that into My Registry for you and issue you your certificates following the end of the session today. So today we are going to talk about the new Mind 2.0 claiming system. We're also going to walk through and troubleshoot some of those common problems that we've been seeing or been having. And we're also going to talk about what happened to your claims prior to September of 2025. So those are our three main goals today. The one thing that we are not going to do, though, is to discuss individual claim errors. So I know that several of you have reported claim issues to our team. We are working diligently to get those processed as quickly as possible. But today we're going to walk through some kind of like user error issues that may be part of the reason that you're having problems, okay? So, but today we are not going to focus on individual claim issues. So please, in that Q&A box, don't put, hey, this is so-and-so from this organization. I don't have an August claim. What I ask you to do is to reach out directly to your assigned analyst, which we will talk about in just a second, and we will help process those again as quickly as we possibly can, okay? So talking about Mind 2.0, the CACFP claim transition to Mind 2.0 in October, and so the first claim that will be in the new platform is September of 2025. So for those of you who have reached out and said, I can't find my September 2025 claim, more than likely the problem is that you're trying to access it into the old Mind Legacy system and not the new Mind 2.0 system. So again, any claims submitted beginning with the September 2025 claim must be submitted in Mind 2.0. Any claims submitted prior to September 2025 must be submitted in Mind Legacy. And we're going to talk about both of those systems today. So how do we submit a claim in Mind 2.0? You are going to log in exactly the same way that you've always done it. You're going to go in through My Login for Business and select Mind 2.0 or the Michigan Nutrition Data System 2.0. From there, this is what your dashboard should look like. Now, yours may look a little bit different depending on what subsystems you have access to, but this is going to be kind of the generic dashboard that you're working with. From that dashboard, you're going to click on the box at the top of the screen that says Child and Adult Care Food Program. So remember, this claim is only for Mind 2.0, starting with your September 2025 claim. Anything prior to that, we're still using the little box up here that says Mind Legacy. Once you get into and you click that CACFP tab at the top of the page, you're going to get a page that looks like this. It is going to have all of the claims for this current school year. So up here in the upper right-hand corner, you can change your school year. So you can either change just the school year or fiscal year, and you can change what your viewing looks like. This is very similar to how it was in Mind Legacy. But right now, you should only be seeing July to June currently because there is nothing else in Mind 2.0 at this time. So along this left-hand side, you're going to have all of your claim months. When you get ready to submit your claim for each of these individual months, you will click on the claim month that you want to submit for. When you're all done with that, you'll be able to come back to this page and see what your reimbursement was, your cash in lieu, how many centers you had, how many sites that you submitted for. So one thing that I'm going to talk about a little bit later on in the session is that each of these subsections within the CACFP claim have their own training pages. So this one that I want to show you now, and hopefully it opens up perfectly the way I want it to, and it didn't. Can someone from the CACFP team just tell me if you can see the new page that I opened up?
No, not yet.
Okay. Let us reshare just to be safe.
There.
Can you see?
Now
Okay.
we can see it. Yep.
So each of these training modules are very interactive. So when you click on here, you can see that there's every little piece has a hover text. So if I come over here to the claim month, it's going to tell me that this is what I need to do to access my claim. Each of these have different tasks or tabs. So this one is going to tell me that after I submit the claim, I need to come back to this screen and I need to certify the claim, just like you've always done. So if you're not a level 3 user, you can't certify your claim. So you need to make sure that your level 3 user within your organization understands that this is how they certify their claim. I had probably 3 sponsors that reached out to me today saying, I've submitted my claim, I'm all set. But then when I go back in, it does show that they're submitted, but they're not certified. So always, always, always make sure that your claim says that it's certified, not just submitted. The other thing that I wanted to show you on this page is you see this little blue box up here that says create claims. In order for you to actually enter any of your claims over here in the left claim month, you actually need to click this create claims box. Now, only a level 3 user can create their claims. So if you are not a level 3 user and you're used to submitting your claims, make sure that your level 3 user comes in, creates those claims, so then you can therefore go in and enter claims for each of these months. Okay. The last thing over here is the status report. So in Mind Legacy, there was a report at the end that you could print that would show all of your claims. It would show your payouts. That is the same in Mind 2.0. So really the only difference between Mind 2.0 and Mind Legacy, the previous claim system, is that it looks like it just got a facelift a little bit. So it's all the same functionality. It just is a matter of the flow is a little bit different. Okay. Christy, can you see the PowerPoint again?
Yes.
Okay, perfect. So the next page I want to talk about is the claim summary page. So this page is where you're going to enter a lot of your information. So over here in section A, all of this information is going to pre-populate from what you put into your actual site. So you don't need to enter anything into there. Section B is going to be used if you have income into your child nutrition program. Now, this could vary a little bit. So for instance, if you have programs where you are, say, tuition, where you're charging for meals, this is where you're going to put your pricing program income. So any income that you have that comes into CACFP should be inputted into Section B. Section C is only applicable for non-school sponsors. So if you are a school, you do not have to put anything into Section C. The rest of our sponsors, so any non-school sponsor, you are going to have to put in information into Section C regarding your cost for the month. Please do not combine months. This should only be for the month that you are submitting your claim for. The only one that is truly required, and it has this little red asterisk, is your food cost. So you must report at least on food cost every month, okay? At the bottom of that claim summary page, you're going to input your data. So you can see this site has already been done. It shows the number of days that service was provided, the monthly attendance, the total enrollment, and then the average daily attendance are both on this section. Yes. So there was a bug in our system a couple weeks ago that just got fixed this week that made it so that schools had to input food costs. That has been fixed. So moving forward, you should not have to enter any food costs into that section. Okay. Just like the previous section, this also has a training page. So I'm going to reshare my screen here. So you'll see on the claim summary page here that there's various information. So there's stuff on the status of the claim. So you can see this one is claim and error. So you know that there's an error in your claim. If there's an error in your claim, you'll see this little red message up here at the top where you can actually click on that and it's going to tell you exactly why you have an error in your claim. Right now, a majority of the errors that we are seeing is because sponsors are trying to enter meals into their claim that they are not approved for. So before you reach out to MDE staff and say, hey, there's an error in my claim, something's not working, please double check that the claim that you are trying to enter is actually approved in your application. So the new Mind 2.0 system allows for all meal services to be entered, but it will not allow you to save or certify if those meals are not in your application. So for instance, if you have an at-risk after-school program and you are serving suppers, but in your application it says that you're approved for snacks, you're going to get an error message because you cannot input meal type for suppers if you're not approved for it. So please double check that before reaching out to MDE and letting us know that you have a claim error. So just like in the old system, you're going to have this summary page that's going to tell you exactly what the meal service type is. So at risk is going to be, reimbursement type is free. If you have any that are, this one's an adult care, so it's going to be free, reduced, and paid. This is going to be that report out that's going to show you exactly how many sites, exactly what your reimbursement was, and how many meals that you entered into the claim system. Let me share my screen. I'm sorry. So this page should look very similar to how it did in the old claim system. The next page to focus on is your site edit page. This is where you're actually going to enter in your meal counts. So up here in section A, you're going to enter in the total number of days service was provided. You're going to enter in your total monthly attendance. So remember, this should be a big number. This is going to be the number of kids that are in care every day for the entire month. So if you have 10 kids the first day, 15 kids the second day, 30 kids the third day, you're going to add all those numbers together. And that's what you're going to put in this monthly attendance. The total enrollment is going to be the number of children that you have enrolled in these programs. So even if you have a child that was only there for one day, they should be counted into your enrollment. From there, you're going to enter in your meals based on free, reduced, and paid. So some of you may have been used to seeing A's, B's, and C's. These, we have updated this to free, reduced, and paid just to make it more consistent across all of our programs and systems. So again, there's another site edit page or another training module that goes to this, and we will send all these modules out to you. They're very quick, very interactive, but they are helpful, especially if you are maybe trying to show somebody else how to use any of these systems. I would definitely recommend going to these or sharing these. So as I mentioned earlier, after saving your claim, you have to go back to the sponsor summary page and certify the claim. Your claim is not submitted until it has been certified. So sometimes we will get people that say, hey, I haven't received payment. And then we go back in and it's like, yeah, your claim was submitted, but it was never certified. So we always make sure to certify that claim and make sure that on that sponsor summary page, it says certified by X, Y, and Z on this date. So that certify button is going to be on the claim summary page up in the upper left-hand corner. The CACFP claim certification page is going to look very similar to your summary page, and it's just going to show you everything that you've entered into the system. And then at the bottom, it's going to say, are you sure that you want to confirm that you are certifying this? And you'll just click that confirm button. Your status report, we talked a little bit about this when we were talking about the dashboard, but you can pull down these reports that give you a very detailed report on what meals that you claimed, the types of reimbursement, so free, reduced, or paid, how many meals that you claimed, and the payment rate that you're going to receive from that. A lot of people like to keep this record for filing systems, or if you need to send this to a business manager or anybody else, this is a handy report to have. I would actually recommend pulling this report, even if you're childcare, so you know exactly what your payment is going to be for that month. There is also the sponsor payment summary report, which I'm not sure how many of you use, but I'm going to show you how to access it. So the sponsor summary report or sponsor payment summary report can be accessed if you go back up to that child and adult care food drop down. And then there's one that says agency reports, and it's called the sponsor payment summary report. This is, go back here. Sorry, I want to open this up so I can show you. So this report is going to show you the sponsor name, the month, the fiscal year, and then the amount that you received in payments. So this is going to give you a snapshot of the entire year. So then that way you can see exactly how much you were paid month to month. You can see if there's any discrepancies. Today I had a sponsor that reached out that said, wow, I received so much more this month compared to last month. When we looked at it, we realized that a lot of the numbers that were put in there were actually incorrect. So it's kind of a good air check or a good way for you to kind of compare month to month what your payments are. So that was kind of a overview of Mind 2.0. Before I move on, anybody from my CACFP team, is there anything in the chat or anything in the Q&A that we should talk about?
There is a question. I'm a sponsor of 16 sites. Is there a way to see each site individual reimbursement? I've only been able to see the total amount of reimbursement.
This is a great question, Kim, and this is something that we've asked for. A lot of our bigger sponsors, and I know 16 sites is a lot of sites. We have some that are even bigger, and so they really want to. They want to be able to see, once I enter in, can I get an exact dollar amount for each of my sites, especially if you are a unaffiliated where you have to send money back out, right? We want to be able to see exactly how much money is being being submitted for each individual site. So right now, no, there isn't, but that is on our wish list and our ask list. And as we continue to kind of find things within my legacy that we're like, you know, what would be really awesome is if we had this. The development team has been pretty good about appeasing us in our wishes. So I will definitely ask that question and see if that's something that we can maybe push a little quicker, because you are not the only person that's asked for that. We have had several sponsors that have asked for that. So I'll put that on my wish list, and thank you for bringing up. Absolutely, checks and balances. Yeah, definitely. Especially if you're using kind of a consolidation checklist, that is very helpful to be able to see what you're entering versus the amount that you're getting paid out for each site for each month. Yes, Veranda, that is a great question. So free and reduced percentages, that is still something that will be entered in if you're a for-profit organization or your site is a for-profit site. You will have to enter in free and reduced percentages in order to submit your claim. So it will not allow you to submit a claim for a site where you are not over that 25% threshold for a for-profit site. Anonymous attendee, I don't know who you are, but your school district submitted already for September, put in food costs. Should we go back and remove those? Absolutely not. Nope, we will fix that on the back end. Nothing more that you need to do. We will take care of that. And then the last one's my register question. Anything else about Mind 2.0 specifically? Okay. Christy, if anything else pops up, just feel free to interject. Okay, so we talked about Mind Legacy is to be used for any claims prior to 2025. This includes any reporting. So if you are trying to find any of the reports that we talked about today, you're going to need to go into Mind Legacy. Okay, so how do we get to Mind Legacy? Mind Legacy is going to be one of the tabs on the left-hand side menu bar in your platform. You do not have to request access separately to Mind Legacy or to Mind 2.0. If you had access to Mind Legacy, you have access to Mind 2.0. They go hand in hand, okay? So once you get in here, you're going to click on the tab that says Child and Adult Care Food Program. And that is going to take you to a screen that looks like this. This is what we've all been used to. This is what we've all been looking at. So a few things in here. Up here in the upper right-hand corner, you can change the fiscal year. So if you come over here and if your program's been with us for several years, you can click on this and you can drop down and you can see all of the claims that have ever been submitted in the history of your program in CACFP. The caveat to this, though, is that you got to change the fiscal year and actually click set.
Kelly,
so make sure that you click set. Yes.
Hold on. I don't think we're seeing what you're looking at.
Oh. What are you seeing right now?
You're still an articulate example.
Oh, I am so sorry. Thank you. Well, my friends, we are going to back up just a quick second. Not that we missed all that much, but
okay.
All right.
Mind
How about on, Christy?
claims. I see Mind legacy claims at the top.
Perfect. Yep. So that's where we're at. So let me just go back a slide really fast. So in order to get to Mind Legacy, you're going to click on the Mind Legacy tab in your dashboard on the left menu bar. From there, you'll click on CACFP, and it brings you to this page. This is what we always see, right? On here, like I mentioned, up here in the upper right-hand corner, you can change your fiscal year to whatever fiscal year that you want to see and click Set. From there, it'll pull down a report that looks kind of like this, where you can see each month when your claim was certified. Notice how it says certified by this person. But then down here under April 2025, it says it's amended, ready to certify. So that tells us that that claim was never certified. So make sure that you go back in here and you click that certify button, whether it's in Mind Legacy or it's in Mind 2.0, to make sure that that information is pushed to make sure that it's pushed to MDE so we can pay you. You can also click on any of these boxes under status that says reports, and that's going to give you a detailed report of what you submitted, when it was paid out, and all of your meal service types. And then also you can go back into any of the months and click on the month to see exactly what was submitted. Notice how down here under September 25, it says not available. That's because September 2025 is going to be in Mind 2.0. So this box here is not going to be available. August will be, so the deadline to submit August is today. So if you do not see August submitted or August lit up here that says available, please reach out to your analyst as soon as possible, because that means that there's an issue with your claim and we need to fix it. So please, September is supposed to be grayed out. It is not going to be submitted in My Legacy, but August 2025 is. All right, so my Mind 2.0 is kind of an unspotted today, but I wonder if there's one. All right, Rebecca, if you want to stay on for just a second, when we're all done, we can take a look at that, okay? So common mistakes that we're seeing right now. My claim is not available. A lot of times why we're seeing this is because a level 3 user must first create the claims. They must first create the claims. If the claim button or create claim button is not available, please verify that the person who's trying to create the claims is a level 3 user. If at that point you still do not see the create claims button, please reach out to us. Please reach out to your assigned analyst and we will get that fixed. So with any system, we're working through some of those bumps and bruises as we're trying to navigate this new program. And so there's going to be a couple little bugs here. If you do not see that create claims button, please let us know and we will get that fixed for you ASAP. So my August claim is not available. So again, cannot stress this enough. Prior to 2025, it needs to be completed in Mind Legacy. Anything after that is in Mind 2.0. My site is not available in the claim. Again, the first thing I want you to do is verify that the information in your coordinated application is correct. So sometimes there's wrong dates selected. So always make sure that you're selecting the correct months in there, because that's how your analyst decides when that site should be active for. Also make sure that your site is not inactive. Make sure that the meals that you're trying to claim are put in the right either NSLP or CACFP. If you look at your application and it looks great and you're like, I cannot figure this out, please reach out to your assigned analyst and we will be able to help assist you. Another common mistake is I'm getting an error message. So the first thing I want you to do is verify that the numbers that you entered in the claim are correct. The error messages within Mind 2.0 are extremely detailed. They will tell you exactly which site is wrong, and they will tell you exactly which meal service is wrong. So please look at those error messages and really process what it's asking for. Sometimes it's just a matter of some numbers were transposed. Sometimes it's a matter of, oh, I'm entering in snacks under at-risk after school, but really they should be under my centers. So make sure that you're paying attention to that. Also, did your license capacity recently change? We see this a lot where your license capacity may be at 50 in the application, but then you have licensing that comes out and now your license capacity is 65. Well, you're going to get an error in the application or in the claim because you're trying to claim more meals than what you've been approved for. So sometimes that means that we have to amend the claim first or the application first to then update your license capacity before we can update the claim. So everything with the claim and the application, they work hand in hand. So we can't usually fix one without fixing the other. So the next thing I want to talk about is the claim deadlines. So the claim deadlines did not change. Everybody should get issued this memo every year. This is the claim deadlines for this school year. So from July 2025 until June of 2026. So we at MDE always say the best practice is to submit your claim by the 10th of the following month. So if you're trying to submit for July, we recommend submitting it August 10th as a best practice. But that final deadline is that hard deadline. That is your 60-day deadline. So you see August, the deadline is today. So the number of people who have reached out to me today to ask about their claims is a lot. Please, please, please do not wait until the last minute to submit your claims, because if there is any kind of issues or something happens with your claim, we can't guarantee that it's going to be fixed by the deadline. So we are working as quickly and as diligently as we can to get those claims updated for August, but please do not wait until the last minute to submit your claims. So what happens if I miss the deadline? So again, we recommend filing and certifying that claim as soon as possible, even if you've missed the deadline. So if you miss the deadline, you can apply for what we call late claim exceptions. So your late claim exception, you have two options. One is what we call a within your control late claim exception, which basically means I forgot. Something happened. I maybe entered it but didn't certify it, or maybe the person who normally takes care of this is out for an extended period of time. You can apply for what we call a within your control late claim exception. You are eligible for that once every 36 months. That's kind of your get out of jail free card, your one free pass. But if you've had a late claim and you've used your within your control exception within the last 36 months, that claim may not be available to you. So you may have lost out on the money for that late claim. So again, please try to get your claims in as soon as possible. The other option is an outside your control late claim exception. And this we don't see very often. This is typically like an act of God or something just crazy happens that you literally could not get your claim in. Maybe your building flooded. Maybe there was just something crazy that happened that is preventing you from getting in, getting your paperwork, and actually being able to submit your claims. So those are your two options. But I recommend filing and certifying your claim as soon as possible, even if you are past that deadline. So as we wrap up here, and we're going to have a chance for some questions in just a second. So those resources that I shared with you, there are training pages, and we call them articulate trainings. They're just very intuitive, interactive, small trainings that are available for Mind 2.0. And there's one for every single page in the claim system. So the ones that I showed you today, those couple that I showed you today, those are all available to you. And actually, Christy, are you able to dump these into the chat?
I don't have your presentation.
Okay, I will drop them in the chat just here a second, okay? So if not, these will be on the resources, and we can also send these out to everyone as well. CACFP contact. So who do I call for questions? Who is my person? So as always, please reach out to your assigned analyst if you're having questions with your claim. We are able to mitigate things. We are able to tell you pretty quickly what's wrong with your claim, or if it's a systemic issue, a bug in the system. But please reach out. Don't sit and stress and waller over a claim that you can't figure out. Please reach out to us. That's what we're here for. But if you're not sure who your analyst is, all of that information can be found on our CACFP website. So there are 5 CACFP analysts, and each of us have an assigned territory. We are more than willing to help you out and get all that. Christy, you should be able to dump this one in the chat though, right? Can you do that one for me?
I can find it to add, yes.
Okay, all right. But if you don't know who to contact and you can't get a hold of your analyst, you can always reach out to the MDE CACFP email address. Our amazing administrative staff will get you to the people that are assigned to you or somebody who can help answer your questions. So if you can't get a hold of your assigned analyst, please reach out to the CACFP help desk and they will figure out where to go. So as we wrap up today, I just want to check, is there any questions in the Q&A that we haven't answered? Christy just put the CACP staff directory in the chat. Okay. Do you know if this would be, okay, Christina, I can't speak for the NSLP status report, so I'm not completely sure about that. I would recommend reaching out to your NSLP analyst if you know who that is, and maybe may be able to give you a little bit more feedback. Unless Tammy, I know you're on. Do you have any update on that or know anything about that?
Yeah, I'm guessing, I don't know what report exactly that is, but if you change your layout, when you select the print button in the upper right-hand corner, you change the layout to landscape, it usually expands it and you can see all the numbers. Try that and see if that doesn't help.
Anything else in the Q&A? Okay, Rebecca, we're going to get you fixed here in just a second. What system do we need to update user access to level 3? That's a great question. So you're going to do that through the request access or user management section within Mind. So on that left side column bar, there's going to be one that says request access. So if you are a current user and you need a higher level of access, you can go in there and request a higher level of access. That will have to be approved by either another level 3 user or your EEM lead administrator, which is usually your superintendent, your owner, your program director, somebody in that sort. But you can also go into that user management and kind of see who those people are. I would also recommend that if you need assistance or don't know how to access that, please reach out to your analyst and they can definitely help you with getting access. And then, is it safe for now from the government shutdown or program cuts? Our fearless leader, Lynn Cavett, is on here, as well as Melissa Lonsberry. Would either of you like to chime in about where CACFP sits with the ever-changing world we have right now?
Hi, this is Melissa Lonsberry, and I'm the departmental manager for the Child and Adult Care Food Program. Currently, we are funded by the USDA. We are not funded by the Department of Health and Human Services, which is where SNAP, Head Start, and other nutrition focused programs are, or early childhood programs are. Currently at this time, we are still receiving funding on a month-to-month basis. So we are operating under our current regulations and policies and are functioning. So, and that is about as much as we are able to say, but at this time, it's still all systems go within the regs. Thank you.
So short and sweet, we're business as usual until we know anything differently. So Patty said you can change your percentage for page printout to 80%, and that will give you all of the numbers. Thank you, Patty, for that little tidbit there. And then Jane, level 3. Okay, so Jane, what I want you to do is I want you to reach out to your analyst, or I'm also going to put my information in the chat as well, and we can do some troubleshooting for you. Any other questions? And if anybody wants to raise their hands, this is a time for you to answer any of your questions. Okay, I don't see anything else popping in here. Uh, yes, Christine, we will share where this training is held. Let me go back here. So you can find this on our CACFP training bubble. So give us a couple days to put this on the website. It won't be there probably this afternoon, but give us a couple days to get this on our website. But if you go to the MDE CACFP website, there are those 6 little bubbles on there. Go to the one that says training and then scroll all the way down to the bottom until you see the one that says Thinking Thursday. All of our previous trainings are also on there. So if you're interested in seeing stuff about preparing for your administrative review or feeding infants, whole grains, any of that stuff, all of those trainings are on our website under Thinking Thursday as well. Oh, and Christy put the direct link right into the chat for us. But seeing no other questions, I want to thank you all for joining us today. And hopefully this eases your mind a little bit about switching to this new system. But please feel free to reach out if you have questions, comments, concerns. We are here to help support you through this transition. And as a reminder, if you have not submitted your August claim yet, please do that because that is due today and we do not want you to have any late claims, okay? So with that being said, thank you again and have a wonderful afternoon.